Another therapy which can be compared with new decision therapy would be EFT, or emotional freedom technique. So what would be the differences of these techniques if we talk about the abilities to release the trauma, or especially unconscious trauma?
Okay, well, I was actually introduced to EFT right around the same time as new decision therapy, and it's a very valid and wonderful technique.
In 1990s?
Yep, yep, when it was first starting to get out there. And I think it's great, and it has its place, and I've experienced some of it myself. It clearly would not have had I don't believe, anyway, to get to the heart of things that we got to with new decision therapy, because at least from the experience that I have had with it, a client needs to come in knowing what it is that they want to address. You know, there's some fear or some phobia or some sort of thing that's getting in their way, and needing to create a different relationship with that fear or that phobia. And the thing with that is sometimes the fear or the phobia can be driven by something that they don't even remember anymore, and that's where new decision therapy can step in and play a role that the EFT cannot. It can help that person get back to the heart of what's truly driving that, and bring it into their conscious recollection. So they may be able to clear with EFT the obvious things that they see are happening, like being afraid to get on a plane or afraid of a snake. But, like, for instance, my anxiety was being driven by a trauma that I went through when I was 14 that I wasn't talking about or even remembering to talk about. So I didn't bring it into any of my EFT sessions.
Yeah,
right?
in most cases, I've heard this idea from many practitioners, actually, from Carrie Mason, from Coburg, and from Dr. Nettie as well, that in most cases, clients or people, we are not aware of the main trauma.
Uh-huh.
And that's probably can be considered as a part why new decision therapy is so effective, because it allows a practitioner with a client to go back to this exact event, which trauma.
And this is actually just triggering something in me that maybe it would be useful for you and I to discuss, for others to hear. And that has to do with this piece of new decision therapy. We look for what's referred to as the last straw event. Okay? And just think about that whole thing, last straw. The last straw is, you know, that saying, the straw that broke the camel's back, right? That piece of straw by itself, it's not all that significant. You couldn't break a camel's back with that piece of straw by itself, right? But when you just add it on to all the other pieces, break the camel's back. So in new decision therapy, we are able to identify what appear to be very minor and insignificant events sometimes, but they're like that piece of straw that turn the tables so that that person is no longer coping with life in the same way. So oftentimes it gets missed because it doesn't necessarily seem to be all of that relevant. And sometimes in a session, you know, let's say, well, I don't need to forgive that. I mean, that person is so insignificant in my life, and yet the body is leading us to pay attention there. And then they go, that was the most significant session that I've had, right? Because everything came together from that so-called last straw event that normally wouldn't even have been paid attention to.
Okay. Another therapy which is used in order to release traumas is called healing touch and related techniques. So do you have experience or comparison? Because I have myself like very little knowledge, understanding about how these methods works and apply.
I think less so. I mean, I learned therapeutic touch years ago to help my mom when she was in pain. And I myself have experienced things like Reiki and polarity, and they all had their place, but none of them helped me get to the things that I needed to know about that were discovered through new decision therapy.